Hi, everyone. Welcome back to the channel. Today, we're talking about behavioral health integration and why this is becoming such an important part of primary care and healthcare overall. As nurses, we already know that mental health affects physical health outcomes every single day. Someone struggling with depression may also struggle with managing diabetes or hypertension. Anxiety can affect sleep, medication adherence, follow up appointments, motivation, and overall engagement in care. Stress, burnout, emotional overwhelm, and social isolation all affect how people manage their health. And many times we nurses see these things before anyone else does. The Centers for Medicare and Medicaid Services, CMS, recognizes behavioral health services as part of supporting patients more comprehensively. So, in this video, we're talking about what behavioral health integration is, the nurse's role in behavioral health integration, the difference between general behavioral health integration and the collaborative care model, and why this is becoming part of the future of primary care. If you're new here, my name is Natasha. I'm a registered nurse and care management consultant. I help nurses and healthcare organizations better understand care management models from CMS. Behavioral health integration, also called BHI, focuses on integrating behavioral health support into primary care. This may include patient follow up, care coordination, behavioral health screening support, medication monitoring, patient education, communication with the care team, and helping patients stay engaged in their care between visits. CMS recognizes that many patients need more support than what can happen during a short office visit, especially when chronic conditions and behavioral health challenges overlap. And this is where nurses, care managers come in and fit naturally. Nurses already understand care coordination, patient education, chronic disease management, and ongoing patient support. We also understand how emotional health affects someone's ability to stay consistent with treatment plans and daily self management. A lot of times, patients open up to nurses differently. They talk about stress, financial pressure, feeling overwhelmed, and struggling to stay consistent with medications or lifestyle changes. Those conversations matter. Healthcare is also shifting toward more team based, patient centered care models where support continues between visits instead of stopping after the appointment ends. Now, when we talk about general behavioral health integration, we are not talking about psychiatric treatment happening directly inside the primary care office. We're talking about coordinated support that helps address behavioral health as part of the patient's overall care. CMS also recognizes something called the collaborative care model, which is more structured and involves collaboration with psychiatric providers as part of the care team. There are different workflows, billing requirements, and coding structures associated with the collaborative care model, and we'll go deeper into that in another video. But what I really want nurses to understand is that healthcare organizations are recognizing that if emotional and behavioral health challenges are not addressed, chronic disease outcomes often suffer too. And this creates opportunities for nurses. Many healthcare organizations and primary care practices do not have the staffing, workflows, or infrastructure in place to support programs like this effectively. That creates opportunities for nurses with backgrounds in care management, case management, behavioral health, utilization management, transitional care, chronic disease management, and patient education. Nurses can help practices improve patient engagement, strengthen care coordination, support value based care initiatives, and improve overall patient outcomes. This is one of the reasons I teach nurses about care management and nurse entrepreneurship. Many nurses already have the skills healthcare organizations need. What's often missing is understanding how to structure those skills into services that support providers, patients, and healthcare organizations outside of traditional bedside roles. Healthcare continues to move toward prevention, care coordination, chronic disease management, and whole person care. If you're a nurse and you're ready to learn more, whether that's partnering with providers or building your own care management business, I go deeper into this inside my mentorship. I'll show you how to actually implement these services, structure them, and get paid for the work you're already trained to do. And if this video was helpful, make sure you subscribe because I'll be breaking down more care management and value based care topics for nurses. Thank you so much for watching, and I'll see you in the next video.